So suppose if I'm in a rural area and I'm just taken care of by a primary physician and there are no nephrologists, or like how do I navigate that system? Like,
Yeah. So one is that primary care is a very stronghold. They're not just primary care. They're
okay,
actually a very important part of our health structure. And they are very smart people who can manage a lot of things. But I do understand that referral to subspecialties take time. Our clinics are booked out 3 to 6 months in advance.
okay,
So we ask all our primary care friends, colleagues to refer the patients as quickly whenever they thought of kidney disease or whenever they thought of a nephrologist. Because by the time we get them in clinic, it's going to take time.
okay,
But upfront, we also have a program. We call it 10 Steps for Primary Care Physicians, how they can manage early kidney disease.
okay.
And I'd be very happy to share those
That
resources.
will be great. So you also said to understand the test, I should know my numbers though. Is
Yes.
there anything like,
Yes, we have a drive called Know Your Kidney Number. So we want all the patients
uh-huh,
to be aware of their kidney number. It is a GFR number that we want them to remember.
okay,
Even if they remember their creatinine, that also is helpful.
uh-huh,
Can I show you a heat chart?
definitely.
Okay, so I want to show you how we classify. That will probably give you a good understanding of what we want all our patients to know.
Okay. So in the meantime, I'll request all our Arcana team members to know their numbers and to figure out what is their kidney number.
Okay. So if you look at this,
Uh-huh.
you see this is how we classify chronic kidney disease. This
Yeah.
chart has been created to help everybody understand
Mhm.
where they are at with this and
Got
what
it.
are the risk of progression. So if somebody is in the green, so you see so out here in the column we have the GFR categories, G1 through G5. We can count. There are 6 actually. So G3 has been divided into 2, A and B, because most of the transitions happen in that time.
Got it.
And that's when most complications start. We would like all our patients to know this part, that where was their GFR last?
Okay.
If they can, because GFR is calculated off their age, creatinine, and few factors. The row here is talking about the protein in the urine. So if you're in the reds, there's very high risk of progression.
Okay.
If you're in the oranges, that's a pretty serious kidney disease. And you can see that we can actually go up if we can manage this part well.
Okay.
We can reverse kidney disease depending on what the driver is. And we follow this chart pretty diligently to see what the risk factors, what is the risk of going to end stage renal disease.
Got it. So I'll repeat in my own language now.
Mm.
So basically, after doing the routine test, which you recommended,
Mm.
I will know my kidney numbers.
Right.
And then we will figure out in which box do I belong.
Right.
And then if I am in the orange or the red box, then I can work hard to come back to the green box. Or...
Yes. Yes.
Okay.
You and your physician both will work together.
Okay.
Yeah.
Okay. Yeah.
You can do it alone.
Definitely.
Okay.
Nothing without the physician.